हेलो एवरीवन, वेलकम टू माय चैनल सिंप्लीफाइड डेंटिस्ट्री। आई एम डॉक्टर कल्पना। आज हम बात करेंगे मैक्सिलरी सेंट्रल इंसाइजर्स के बारे में। मैक्सिलरी सेंट्रल इंसाइजर्स आर द वाइडेस्ट एंटीरियर टूथ एंड दीज आर इवन वाइडर एंड लॉन्गर देन द मैक्सिलरी लैटरल इंसाइजर्स. These teeth are developed from the four lobes, that is, one is present at the mesial side, one at the facial, and one at distal, and another is at lingual side. Okay, according to FDA number system, these tooth are labeled as this. This is of right side, that is 1 1, and for left side, that is 2 1. Now if we look at the eruption time, these teeth are erupt at the age of 7 to 8 years, and the root formation of these teeth are completed after 3 years of their eruption, that is of 10 years. Okay. Now if we look at the dimension of this tooth is at the cervico-incisal. This is cervical area and this is the incisal. At the cervico-incisal is 10.5 mm, 10.5 mm. Okay, and when we look at the mesiodistal length, that is of 8.5 mm, 8.5 mm. Okay. Now we will see the tooth in every aspect. Okay, now first one is labial aspect. From labial aspect, let's see here. Okay, from labial aspect, from this side the tooth is wider and this side the tooth is less wider. So if we draw a shape here, it is approximate like a trapezoidal. So from the labial aspect, it resembles like a trapezoid. So trapezoidal shape is present, and the dimension of cervico-incisal is greater than the mesiodistal diameter. Okay. Now if we look at the incisal edge is perpendicular to the long axis of the tooth. The incisal edge is perpendicular to the long axis of tooth. Now if we look at the angles, so this is mesial angle and this is distal angle. Okay, so mesial angle is less rounded than the distal angle. Okay, mesial angle is less rounded than the distal angle. And if we look at the distal side, the distal side is more convex. Here the distal side is more convex than the mesial side. The distal side is more convex than the mesial side. Now if we look at the height of contour, the height of contour at the mesial side is at the incisal third, but the height of contour at the distal side is at the junction of the middle and incisal third, is at the junction of the middle and incisal third. And in mesial side, it is at the incisal third. So let's take it a look again. It is of trapezoid shape. Cervico-incisal width is more than the mesiodistal width. Incisal edge is perpendicular to the long axis. The mesio-incisal angle is approximately 90 degree and the distal incisal angle is rounded in comparison to the mesio-incisal angle. Now distal surface is more convex. Okay. Now one more thing, there are imbrication lines. There are imbrication lines present at the cervical third of the central incisors. Central incisor. Now come to the lingual aspect. The labial aspect is smooth surface, but the lingual is not. Lingual surface had more convexities and depressions, concavities and convexities. So first of all, the tooth is narrower than the facial view. Okay, tooth is narrower than the facial view, and cervical line is more deeper. This cervical line is more deeper than the facial side. One more thing, the cervical line is to convex towards the apex. It is convex towards the apex from lingual and in this and at the labial view also it is convex towards the apex. It is convex towards the apex. Okay. Now the convexity. Here a smooth convexity is present below the cervical line. Here the smooth convexity is present. This is known as cingulum. This is known as cingulum. And the concavity present just below the cingulum is fossa. That is our lingual fossa. This is our lingual fossa. Okay. Now the lingual fossa is surrounded from superiorly by cingulum, laterally by, this is distal marginal ridge, and this is mesial marginal ridge, MMR. This is mesial marginal ridge, and inferiorly by incisal edge. Okay. Now come to the mesial side. Okay. Now if we look the shape here, it is of triangular or wedge shape, in which the base is towards the apex, and the base is towards the apex, and the apex of the triangle is towards the incisal edge. Okay. Now here we see the cervical line. The cervical line is concave. It is concave towards the apex, but we have seen in the labial and lingual side it is convex towards the apex. Here it is concave towards the apex, and it is generally true for all the tooth. At the mesial and distal side it is concave towards the apex. Now if we draw an imaginary line, through the incisal edge at the height of CEJ and apex, it all falls in the same line. These all falls in the same line. Now if we look at the distal aspect is similar to the mesial aspect, but the difference is the cervical line curvature is less curved, less concave than the of mesial side. At mesial side it is of more concave. At the mesial side it is of more concave. Look at this. It is more concave. This is more concave than the distal side. Okay. Now if we look at the incisal aspect, so incisal aspect the mesiodistal diameter is greater than the faciolingual diameter. Okay. Now if we look at the pulp, it has 3 pulp horns. The tooth has 3 pulp horns. Okay. And only 1 pulp canal. Okay. And if we look at the root is triangular in shape. The root is triangular in shape at the midroot cross section, because we have seen earlier that the crown is flatter from labial aspect and is more convex in lingual aspect. So that is why it has triangular cross section. Okay, thank you.